Yeah, we are delighted to have Ilene Shiller join us today. Um, those of you who attended the Myeloma Canada National Conference 2 years ago, she was one of the speakers in one of the breakout rooms. The presentation today will be more comprehensive. Some of us have attended a similar presentation that she has made, and it is really excellent and very comprehensive. So Ilene is the manager of financial and workplace programs at Wellspring. She meets one-on-one with clients through the Money Matters program at Wellspring and leads the return to work, wellness at work, and brain fog support and education programs. Ilene specializes in the area of income options for people who are too sick to work and return to work issues when patients are in recovery stages. Ilene leads workshops for patients and cancer organizations and trains healthcare professionals. Through this experience, she has amassed extensive knowledge at both the front line and also the policy level. Ilene holds a Master's of Social Work degree from the University of Toronto. So there is a huge wealth of knowledge that went into today's presentation. So with all that in mind, and for sharing her time today on this beautiful Saturday afternoon, would you please join me in giving Ilene our most warm welcome? And please clap. Ilene can see you.
Thank you very much. Thank you for your virtual welcome. It's very much appreciated. I just want to mention, just because we are recording the presentation, a couple of things. With these government programs, they change all the time. So, just for those that are listening via recording, this is, the stuff is accurate as of June 5th, 2021, and always, check for changes to the programs, again, because they arise frequently. And also, if you happen to be listening to the recording from outside of Ontario, just to let you know that I'm an Ontario registered social worker. So today we'll be focusing on the federal programs that do apply across Canada, but also on the Ontario disability programs as well. So just wanted to mention those housekeeping things before we get started. And I think a number of you are familiar with Wellspring, but what I'll start off with today is I just want to give you a very, very brief rundown of our programs and what's available. I want to tell you a little bit more about the financial and workplace programs that I'm involved in. I want to start things off as to why I do this presentation by showing you a little bit of the research that's out there on the financial impact of cancer. And then I'll focus in on the programs. So I'm going to look at income replacement options. So those are what your options are if you have to stop working for treatment. And then I'll also focus on other resources that might be available outside the income replacement sphere. And those are things that might help you with medical, household, other expenses. So that's what I hope to cover today. So quickly about Wellspring, we were established back in 1992, and we now have 8 centers across Canada. And because of COVID, we quickly pivoted. We had a few online programs when COVID hit, but we quickly pivoted almost 90% of our programs onto our online platform, which is called Well on the Web. And through Well on the Web, and then when we open our centers again, we're there to offer our programs to anybody with any type of cancer, any stage in their cancer journey, no charge and no referral needed. And our programs cover a number of different areas online. We still were able to maintain and have interactive group programs, support groups, and things like that. We have webinars where larger audiences can listen. You can go on and do webinars and listen to our audio resources whenever you like through our self-paced resources. There's stuff you can download. And then we still do have a number of programs where you can connect one-on-one with either a volunteer or a program leader, depending on the program. And they cover a wide range of areas: emotional, physical, functional, practical, informational, and social. We have special family programming, new programming for those that are living with a chronic cancer, our OASIS program for advanced and palliative cases, and our bereavement programming. And, just some examples in the emotional support area: number of support groups, expressive art workshops, there's relaxation and visualization, meditation workshops. And then on the more practical and physical, we have our cancer exercise program, again, which is able to be done online, brain fog, nourish, nutritional seminars. We have different types of yoga programs and our Be Well talks that cover all different types of topics relevant to cancer patients. And as you are likely aware, we are very thrilled with our new partnership with Myeloma Canada that was launched in March 2021. And we now have specialized trained peer support volunteers that are able to talk one-on-one with myeloma patients, either by phone or an online platform like Zoom. Very easy to access. You can find links on the Myeloma Canada or the Wellspring website. And if you go to our Well on the Web online programming, you'll see, you'll find myeloma peer support, and you'll be able to click in the little red square, and that will give you a link to an email that's sent to Wellspring, where you'll be able to set up a time to talk with a myeloma peer support volunteer. And then my roster of programs is Money Matters, Returning to Work, and Wellness at Work. And Money Matters, and I invite you always to contact me. I'll give you my contact information at the end. And that's an opportunity to have a one-on-one appointment with a case manager to help discuss your particular financial concerns and issues, to help you come up with a plan if you're unable to work, or help you transition back to work if you've taken time off work for treatment. If you are in the process of thinking about returning to work, want to assess your readiness, want to get ready, we have a 6-week online support and education group that helps people transition back to work. Once people are back at work, well, we also have, if you happen to be on long-term disability and want to find out a little bit more about the ins and outs of long-term disability, we do have a self-paced video series on our website. And then when and if you do transition back to work, we do have a once a month sort of support and education group that covers different types of topics that are relevant to people who have just returned to work and need a little bit of extra support to help them with that transition. So a little bit of what I do. Back to the beginning and talking about why we came up with our financial programs. And that's because what the research says. And, they started doing research, around 2010, even earlier in this area. And you'll see there are a number of studies since that time that show that cancer for sure has a financial impact on people. Income decreases are reported in study after study. Even a more recent study done with young adults with cancer found that they reported a significant financial gap between them being a young adult with cancer and their peers. So, this research highlights this time and time again. And what causes that financial hardship? Well, the big one is the lost income. Often the patient has to stop working for treatment, may not be able to return to work, and same with the caregiver. We know all about the travel and parking costs. Some people choose to add alternative treatments that aren't covered by any government source. You may need extra housekeeping and childcare, out-of-pocket drug costs that might not be covered by the government or by a plan, and then your medical supplies. And that's, just a small list. And one interesting study took a look and asked patients, okay, we recognize this financial hardship. How did you cope with it while you were, going through treatment, even if you were accessing income benefit programs? And you'll see a large number, 44%, had to dip into their savings and their investments. Some had to take on debt. Some worked during treatment or had to return to work before they were truly ready to return to work. But what's consistently reported is, the stress of the financial burden. And I can't tell you how many times I speak to somebody in the Money Matters program who will say that the financial stress is almost as bad as dealing with the stress of my medical condition. So it's a tough situation. And I think that what makes it a little bit more difficult is a lot of people, I think, who haven't had to take off work due to illness, have this, as this study said, sort of a sense of security that maybe, isn't well founded, thinking that the government programs are going to help, you can access that rainy day fund, you have long-term disability through work, but as you'll see from the numbers I'm going to show you, that they don't always make up for that shortfall that people experience, and hence the financial hardship. So what I'm going to do today is just talk to you about the different ways that people can address the financial hardship. And I like to focus on 3 different areas, the main one being income replacement. So what programs are out there that can help you if you have to stop working. I'll then talk a little bit about programs that are available to help people with their different types of medical expenses. And then another way to help with your financial situation is to see if there's something that might be able to help with your household and other expenses. So I'm taking it from that area as well. So we're going to start off with income replacement. And I like to divide the income replacement programs into 4 categories. So there are the financially tested programs. So those are the programs that before they even look at your level of illness, they want to know how much income is coming into your household and what do you have in the way of savings and assets. There are the contribution-based programs, and those are the ones that when you look at your paycheck, you're contributing to, so, EI and CPP. The workplace programs, so benefits that you get through work, and then personal resources. So those are those resources, the money you put aside, savings, investments that are personal to you and vary from individual to individual. And so more specifically, the programs we'll talk about today on the financially tested programs. So those are our social assistance programs, and that's Ontario Works or Welfare, and the Ontario Disability Support Program. On contribution-based programs, we'll look at employment insurance and Canada Pension Plan. Workplace programs, we're going to talk about short-term and long-term disability very briefly. And then again, I'll just talk a little bit about the personal resources you may have access to, so your personal assets and any private insurance that you might have. So I'm going to start in the top right-hand corner with the contribution-based programs, which are the programs that are offered by the federal government. And we'll start off with employment insurance benefits. And I like to start off with that program because that's typically the first program that people access when they have to stop working for treatment. So a lot of different types of EI benefits. I'll only focus on the ones applicable to us, but there's EI regular benefits. So that's what you would access if you were laid off from your job. There are a number of different types of special benefits that we'll talk about today. And there's a separate program that not a lot of people know about where people that are self-employed can actually enroll and have access to employment insurance special benefits. So the first program that applies and is accessed frequently is our employment insurance sickness benefits program. And it's a very easy threshold for getting onto it. You just have to be medically unable to work as certified by a doctor. With COVID, they have lowered the number of hours that you need to have worked in order to access employment insurance. So prior to COVID, you had to have worked 600 hours in the previous year to access employment insurance sickness benefits, but now they've dropped that to 120 hours, realizing that people will not have worked as much in 2020 and into 2021. Easy in terms of the paperwork. It's an online application. It's a simple one-page medical certificate that any of your doctors can fill out. And then your employer issues you a record of employment just showing that you've gone on a sick leave. And you can collect employment insurance sickness benefits for up to 15 weeks. If a family member or close friend has to, it has to be a close friend that is like a family member to you. If they have to take off work to provide caregiving to you, they may be eligible for employment insurance family caregiver benefits. And that's, again, available if you're taking off time to care for a critically ill or injured family member. Again, a lower threshold of hours, just 120 hours in the past year. And the same type of certificates, your medical certificate is going to be pertaining to the person you're taking care of. And EI family caregiver benefits are available for 15 weeks if you're taking care of an adult, and up to 35 weeks if it's a child that you're caring for. Compassionate care benefits are another type of benefit that is available to a family caregiver, but in this case, it's for taking care of somebody who requires end-of-life care. And that is if they're caring for somebody that has a serious medical condition with a significant risk of death within 26 weeks. So it's for a more palliative case. And again, 120 hours, same thing with a medical certificate and a record of employment. EI compassionate care benefits are available for 26 weeks. And depending on the medical condition of the person that you're taking care of, you can combine EI family caregiver and EI compassionate care benefits. Again, if you meet the eligibility requirements for both, so that would give you 15 plus 26 for a total of 41. As I mentioned, what many people don't know about is self-employed people can actually access employment insurance special benefits. So they can access sickness benefits and family caregiver and compassionate care benefits. There's a special enrollment procedure that they have to go through. They have to enter into a particular agreement. And instead of paying premiums on their paycheck as an employee does, what they do is they file with their tax return a premium that's based on their self-employed earnings. So not a lot of people have enrolled in the program because not a lot of people know about it, but it's, again, if somebody doesn't have any private insurance, it's something that they may want to consider. And sooner rather than later, there's an odd rule that you can't, if you apply in 1 year, you can't access benefits in that year. You have to wait until the following calendar year. So just something to think about as an extra source of benefit. In terms of employment insurance, all the benefits pay the same amount. It's 55% of average weekly earnings. With COVID, they've actually put a minimum in place for the first time. So anybody applying is going to get a minimum of $500 per week. And then a maximum, it's actually, sorry, I have to update the slide. It's $595 a week for the maximum. It's a fairly straightforward online application. If all goes well, your employer gets in the record of employment. You're looking at your first payment probably in about a month. And just something to keep in mind, employment insurance benefits are taxable, and they will withhold a little bit of tax at source. So that is our employment insurance program. I'll move on now to our other federal program, which is Canada Pension Plan Disability Benefits. So everybody knows Canada Pension Plan for our retirement benefits, which we are going to get at 65 or 60 if we want to take them early. There is a companion disability benefits program that's available if you're under 65. And there are two ways to qualify. You have to have the sufficient number of contributions, and you have to meet their definition of disability. And the way you prove your eligibility is there's a long application form for the patient, and then there's a medical report that the doctor fills out. And unfortunately, it takes a long time for CPP disability applications to be approved. It could be 4 to 6 months, but as you'll see, there's an expedited approval process for multiple myeloma. So in terms of the contributions, they will basically look to ensure that you have contributed to Canada Pension Plan in 4 of the last 6 years. If you've been contributing for at least 25, it'll be 3 of the last 6 years. And if you're curious to see if you have enough contributions to apply, if you're currently working but want to see what your options are if you have to stop working, you can call Service Canada and order what they call a statement of contributions, and that'll give you your contribution history and an estimate. And as well, if you have a Service Canada account, you can access the information online through that. A lot of people think that if they are self-employed, they don't contribute to CPP, but you actually do, and you actually contribute twice what an employee contributes, because you're doing the employer portion and the employee portion. So again, depending how your self-employment income is structured, you may have enough contributions to apply, and it would definitely be worth looking into, checking with whoever prepares your tax return, or again, getting a statement of contributions from the government. So again, if you have sufficient contributions, you then want to look at the definition of disability, and you don't have to make a judgment, but just it's good to have an idea of what they're looking for. And what they're looking for is an illness that is both severe and prolonged. So for severe, the easy way to think of it is they're looking for something that prevents you from doing any type of work that you would do regularly. And they're also looking for a little bit of a length criteria. So they're looking for something that's going to keep you out of the workforce at least a year. If you have a treatment plan that is less than a year, I always say it's worth applying, because we don't have a crystal ball. Treatments get delayed due to side effects, due to changes in treatment modalities, things like that. So I always say it's worth putting an application in if you are able to, and if the doctor will support you. So as I mentioned, multiple myeloma gets a faster review than certain other illnesses because they call it a grave illness for CPP purposes. And so you get a decision within 30 calendar days. You may not get the money that fast. There's a 4-month waiting period with CPP disability, but just good to know that you will get a fast decision. For those with terminal illnesses, there is a very fast review process where you would get a decision within 5 business days, and it's also a much shorter form for both patient and doctor to fill out. And what do you get from CPP disability if you are approved? So the average back in as of January was just over $1,000 a month. The maximum, so somebody that's contributed for all of their work life, is about $1,400 a month. And then there is an extra children's benefit. So if you have kids under 18 or kids 18 to 24 who are in full-time school, you would get an extra $257 a month. Suzanne?
Oh, quick question. Can you go on and off CPPD, meaning can you get it for a year or 2 years and then go off if you start working, or kind of once you're on, that's it?
No, that's a great question. So CPP disability is great. So when you're on it, they will actually let you earn up to about $6,000 in a calendar year before you have to pick up the phone and tell them you're working. So it's a really good way for people to just try doing a little bit of work. Mm-hmm. And if it doesn't work for them, they can just, stop working and go back on. And a lot of people will start working, let's say September, October. So they have, until December to earn it's $6,100. And then January, the clock starts ticking again, and you can start earning your up to $6,100. But let's say, you've tried working, it's going great, and you've hit that $6,100. You're going to pick up the phone and you're going to call Service Canada. They'll send you a medical assessment package. If you're still working sporadic hours, nowhere near the regular amount, you may be able to work and continue to get your benefits, but otherwise they will stop your benefits. And all you have to do, if you need to go back on within the next couple of years, there is a rapid reinstatement program. So there's a really fast one if you're going back on it and it's been less than 2 years that you've been off it. And then between 2 and 5 years, a medium fast. So the bottom line is, if you need to go back on it within 5 years because of the same illness, it's an expedited process. So yes, you can go on and off it.
Okay, great, thanks.
Okay. Okay. A lot of people worry that if they collect CPP disability benefits, there's going to be less for them when they go retire. I put up this slide, just this is one of the questions I get asked, almost regularly. It will not have a negative impact. In fact, it may actually add a teeny little amount to your CPP retirement, because when they go calculate your retirement, they'll actually back out the years that you were collecting disability. And then it's easy if you are on CPP disability benefits, they will automatically convert to CPP retirement benefits at age 65. So good to know. Okay, so something that came in to effect a couple of years ago is what we call the CPP post-retirement disability benefits. So you can collect early CPP retirement between ages 60 and 64 at a reduced rate. And so some people will be collecting them and then get diagnosed. If they've been collecting their retirement benefits for under 15 months, they can just file the CPP disability paperwork and convert to CPP disability. And that's a good thing to do, because CPP disability will always pay more than CPP retirement. If they've been getting their CPP early, but for more than 15 months, they now have what they call the post-retirement disability benefits. And what they'll just do is tack on an extra $510 a month if you qualify and meet the requirements for CPP disability. So all this by way of saying, if you are 60 to 64 and have taken your CPP retirement benefits early and feel you may qualify for CPP disability, it's something definitely worth looking into, because you will get an increased monthly amount. And then for those that are over 65, so once you turn 65, CPP disability and the Ontario Disability Support Program are not available. So you will, be accessing your CPP retirement and your old age security. If you're in a situation where your household income is below a certain level, you may be eligible for a supplement to your old age security, which is called the Guaranteed Income Supplement. And if you are eligible for the Guaranteed Income Supplement, which is federal, Ontario will also tack a supplement onto your check called Gains. So that's something you always want to double check. If perhaps you've been on CPP retirement and old age security for a number of years, didn't qualify for a guaranteed income supplement, maybe one household member was still working or had some sort of investment income or something of that nature. If you feel that your income has gone down, it would definitely be be worthwhile looking into whether you may qualify for the guaranteed income supplement. And similarly, allowance is something that a lot of people don't know about. And that's if you have someone in a household who is over 65 and earning, getting the old age security and the guaranteed income supplement, and their partner is between 60 and 64. If, again, the total household income is below a certain level, you may be entitled to what's called the allowance. So again, something worth looking into. And if you look on the government websites for the Guaranteed Income Supplement and for the allowance, it'll show you what those dollar amount thresholds are. Okay. So why don't I talk a little bit about Ontario Works and Ontario Disability, and then we can take a little stretch break. So Ontario Works used to be called welfare. And as I mentioned, it's a financially tested program. So what they're going to look for before anything else is that your liquid assets are under a certain level. And liquid assets is, cash, money in the bank, investments. It's not your house and it's not your car. So they let you have those. And for Ontario Works, it's very, very low levels. So for somebody that's single applying for Ontario Works, you'd have to have under $10,000 in liquid assets. And then you would have to be in a situation where your household income was very, very low as well. And then Ontario Works is really what they, term as an emergency program. So it's really for somebody who's, out of a job and doesn't have another source of income, is just unable to participate for a short time in the workforce, or is disabled and will be ultimately getting Ontario disability. And as you can see, you read in the news the amounts that you're paid by the various programs. It's very, very tough in terms of, paying rent, if you're in the city of Toronto or surrounding areas. They pay you, part is based on basic needs and part is based on your shelter costs. And I see there is a chat. Oh, okay. Sorry, not a question. Tax-free savings account is considered a liquid asset. Yes. Somebody asked that. So with Ontario Works, there are extra ways where you can sort of try and get a little bit of extra money. The wonderful thing is you get a drug card, which covers a lot of prescription drugs that are on Ontario's formulary. There's some extra, vision benefits. I highlight special diet allowance because if you have, a medical condition, lactose intolerance, weight loss from cancer treatment, celiac disease, there are extra funds that you can apply for and try and get added to your check. And similarly, I highlight travel and transportation costs because Ontario Works is often prepared to add some extra money to your check to help you with your transportation costs. Okay. And then the Ontario Disability Support Program, which is again the companion program to Ontario Works, but for those that have a disability. And again, liquid assets below a specified level. So for a single person, it's $40,000. For a couple, it's $50,000. Again, your household income has to be below what ODSP would pay you. Although there's a special calculation for that. So always check your eligibility. And then what they're looking for, their definition of disability is a substantial physical or mental impairment that is, again, going to last greater than a year. So like CPP disability, they're looking at that magic 1 year mark, and it has to have an impact on your daily living. And that's basically your ability to work, your ability to function in the community, your ability to take care of yourself. So that's what ODSP is looking for in terms of eligibility. What does it pay? Well, again, part basic needs, part shelter, but as you can see, the amounts are larger than Ontario Works. So close to $1,200 for somebody single, $1,750 for a couple, and then it goes up a little bit for a couple with a child. And then those opportunities to get the extra funding, but you do get a drug card. Ontario Disability does pay for, a good deal of dental work, some vision care benefits. And again, the two ways to try and get a little bit more money from Ontario Disability is going to be the special diet allowance and trying to get some money for medical transportation. So two things to think about. And actually, let me just quickly talk about short-term and long-term disability, the workplace programs, because I just deal with them. I always put unique contract because everybody's workplace is going to have a slightly different short-term disability policy. So it's always good to read your benefit booklet. They really, really vary in terms of what they pay. They'll generally pay 60 up to 100% of your salary. Again, they vary in length. I've seen some as short as 6, some as long as a year. Your short-term disability may be paid by your employer, so it just looks like a regular paycheck, or there will be an insurance company. At the very least, there's always an insurance company involved to help review medical paperwork. And I find that more employers are eliminating short-term disability or not getting it in the first place just because it's a very expensive benefit. And then you may have, again, long-term disability through your employer. So that would be group long-term disability, or some people who are self-employed purchase a private long-term disability policy as some extra income protection. There's typically a waiting period before it starts, and that's because you're collecting short-term disability or you're collecting employment insurance sickness benefits. And it'll also pay a percentage of your salary. The typical is 66%, but again, there are many different formulas and levels. And again, depending on who pays the premiums, long-term disability can be taxable or it can be tax-free. With personal resources, again, those are things that are going to vary from person to person. You depend on age, if you've had time to put money aside in savings. With cost of living and housing costs in the GTA lately, it's a tough thing to have. But again, these are things you might want to evaluate and see what you may need to access in terms of savings. RRSPs is a tough one because there's a tax hit if you have to cash them in. People will often have to, perhaps refinance homes or sell a second property, that type of thing. Critical illness insurance is a phenomenal product, very expensive. What I've noticed over the past couple of years is more employer-sponsored plans have a critical illness component to them. So I always encourage people to, if they have to access disability benefits, to also quickly check if there might be critical illness insurance available. As I mentioned, some people will have private long-term disability if they are self-employed, that they might have, taken out when they first set up their business. Some types of life insurance, if you're in a tight spot, you may have, some sort of living benefits available. Just a couple of things. And I always encourage people, in these situations to speak to a financial professional about what to access if needed, be it a financial planner or a chartered accountant, that type of thing. Okay, so we're out of the income replacement programs, and so sometimes people, will come for an appointment with me, and they'll already be on CPP disability, or they'll already be accessing their long-term disability benefits, or they'll be over 65 and are already, getting CPP retirement and old age security. So I'll try and look for other areas where people might be able to find help. And the number one place that we'll start is with drug coverage. Nowadays, I find I don't give as much advice in the area of drug coverage because the cancer centers now have wonderful drug access navigators that know all the ins and outs of accessing drugs and know how, what about the provincial public drug programs, are happy to communicate with your insurance company to see if a particular drug is covered. And then, as you've probably seen, where insurance doesn't cover the full portion of a particular drug, there is sometimes compassionate access available through one of the manufacturer's programs. So all things to look at. And in terms of our programs in Ontario for drugs, we have our Trillium Drug Program. So that's what I sort of say, that's our public drug program that's available to anybody in Ontario under the age of 65 with a drug card, with a health card. And what it basically does is they look at your household income and they calculate a deductible based on that household income. It's about 4%. And it's not a deductible in the true sense that you have to, shell out the money to Trillium. What it is You buy your drugs until you hit your deductible, and then the government kicks in the rest. So that's how our Trillium Drug Program works. So if you do have high drug costs relative to your income, it is a good program to look into. If you have very, very high drug costs that your private insurance doesn't cover the full portion of, sometimes people will use the Trillium program to help them offset the out-of-pocket cost for that particular drug. If you are receiving nursing care at home, so through what was called CCAC, then the LIN, and now it's called Home and Community Care Support Services. If you have a nurse, not a home care worker, but a nurse coming in, you may be entitled to a government drug card. So that's something to keep in mind. If you're on Ontario Works or Ontario Disability, you have access to a drug card. We have our Seniors Drug Program. And with the Seniors Drug Program, a good thing to check. So when you enroll in the Seniors Drug Program, you have to pay $100 of drugs out of your own pocket. If your income is below a certain level, you can apply for a waiver of that $100, and you'll just have to pay, a dispensing fee on the drug. So that's something to look into. And then for those that are 24 and under, we now have OHIP Plus, which helps with covered drug costs for younger people. Assistive devices, again, if you have mobility devices or colostomy products or anything of that nature, we have our Ontario Assistive Devices Program that covers part of the cost. And then you can also see if anything is available under any private or group health insurance you may have. And there are also a number of community organizations that may help. So for example, March of Dimes has an assistive devices program that can help with costs. Salvation Army and some jurisdictions help. So again, always good source to look for community organizations. And then other sources of help for medical expenses, again, if you need help at home, so not housekeeping, but sort of from a personal support worker and can't afford somebody privately, you can contact your local home and community care support services, or LIN or CCAC as it was called, and do an intake there and see if you're eligible for any home care hours. So that's just a good thing to know about. There are charitable organizations out there that do help with some costs. So for example, I apply monthly on behalf of some of my clients to an organization called the Shine Through the Rain Foundation, and they help with overdue utilities. They help with transportation costs, so parking at the hospital, Uber, Lyft, taxi. And they also help, I'll talk on the household front with grocery gift cards. So again, for those that are in active treatment, there are charitable organizations out there, and it's worth looking in your municipality to see if there's anything there. And also always good to check with your local offices, again, of community organizations, Lions Club, Kiwanis, Salvation Army, Red Cross, that type of thing, to see if they have any. Sometimes they'll loan medical equipment. Sometimes they'll have a ride or drive program, that type of thing. For low-income seniors that live in the city of Toronto, there is something called the Hardship Fund. And if you have a one-time medical cost that you just cannot afford because it's more than your budget for the month, you can do an intake with the city of Toronto and see if they may be willing to fund part of this one-time medical costs. So that's our hardship fund. And then now, luckily, as of, I guess it's about a year now, we now have a seniors dental care program that helps seniors with the low-income seniors with the cost of dental care. If you are not a senior and need some assistance in terms of dental care, and are not on any, like the Ontario Disability Support Program, most of the cities will have low-cost dental clinics affiliated with Toronto Public Health, and so you can get less expensive cleanings and less expensive procedures. There are wait lists, but those resources are out there. Tax credits, again, I am not a tax expert, but I like to mention these to people just as something to discuss with their doctor or discuss with whoever prepares their taxes. The first one is our disability tax credit. So that is what they call a non-refundable tax credit, meaning you can use it to reduce your income tax payable. So if you have all, tax-free income coming in, it's not going to be a help to you. But if you do pay tax each year and you are eligible for the disability tax credit, it may help with reducing that tax burden. Somebody had just asked about eye exams and OHIP, and I read the same thing, that they're thinking of stopping covering eye exams under OHIP for certain ages. So yes. The disability tax credit, you apply for it, as you'll see, it's a certificate, but it's about maybe 10 pages, and it's filled out by your doctor. And what they are looking for is you have to meet one of these following criteria. So you have to be blind, or you have to be what they call markedly restricted in at least one activity of daily living. So it's speaking, hearing, walking, eliminating, feeding, dressing, or mental functions necessary for everyday life. So you have to be markedly restricted, so have a very difficult time doing those type of activities on your own. Or if there's a few different categories you fit into, and your doctor feels that you are significantly restricted, that may also qualify you. A hearing aid somebody just asked about a hearing aid counting for, hearing aids are covered under assistive devices. Hearing impairment would not be one of the criterias for basic living for the disability tax credit. No, unfortunately not. And then the last criteria is life-sustaining therapy, which in most cases, believe it or not, does not include chemotherapy. It's got to be a life-sustaining therapy, so something that it takes it's something you need to engage in 3 times a week for up to 14 hours. So it's something more like if you're type 1 diabetic and have to monitor your glucose and administer your insulin and that type of thing. They are, the last budget, they're trying to open up the definition of life-sustaining therapy a little bit, so it may be easier to qualify, but just that's one of the other criteria. So just something to think about. With the impairment and the disability tax credit, again, they're looking for something that's going to impact you for at least 12 months, and it's got to be a impairment that's present all or substantially all of the time. So as you can see, it's a very, very steep definition of disability. But what I always tell people is there's no harm in having the conversation with your doctor about it. I find the hematologists and oncologists are not interested in filling it out, which I understand. But I think the better person to go to is your family doctor, who has sort of a better idea from a whole person perspective how you're doing. So again, I know some people don't have family doctors or don't have great family doctors that would support them in this. But again, I always say, I'm not sure if you would qualify, but again, have that conversation, bring the certificate to your next appointment and have the discussion. Just because, again, it's a very helpful tax credit tab. The other change that came out in the budget that may come in, depending on whether all of the budget goes through, is they've increased the definition of mental functions. So again, if you're dealing with any type of brain fog from your treatment, attention issues, memory, focus, concentration, again, it's something you might want to look into and keep tabs on the upcoming amendments. So for the disability tax credit, there's no minimum level of income. Again, it's what they call a non-refundable tax credit. So what they do is, if you're eligible, a calculation is made when you input everything that is based on your income, and then it sort of spins out a number, and that is the number by which the tax payable would be reduced. So it's not going to generate a stream of income. It's not going to, get you a refund. What it's going to do is just make your tax bill a little bit less if you qualify. So again, you've got to have taxable income and have income tax owing on your tax return in order for it to be of benefit to you. And I should say, some government websites are difficult to navigate. The disability tax credit website from Canada Revenue Agency is actually a really good website, and they have helpful little videos that talk about the credit and talk about how the credit works and talk about the eligibility requirements. So I like the videos, and they also have very helpful little examples of people that would and wouldn't qualify and how they would qualify. So I also find that very helpful. So I encourage you, if this is something you want to look further into, look at the website first, speak to your family doctor, and take it from there. Stem cell transplants may again make you eligible again because of the impairment post. Stem cells may make you eligible because of if there's a level of impairment post transplant. And what you need to take to the family doctor is it's the disability tax credit certificate. It's the T2201. If you can't find it online, again, I'm going to give my contact information at the end. Please feel free to reach out, and I can email it to you. The medical expense tax credit. So you may already be saving those receipts that you then put on your tax return. Again, it's a non-refundable tax credit. And the way it works with the medical expense tax credits is all of those receipts that you save have to add up to a certain percentage of your income for it to have a positive impact for you. And again, on the CRA website, there's a great search function. You can put in your medical expense and it'll tell you if it's eligible or not. But this is just a very small cross section of things that may apply to you. So if you had to pay dental services out of pocket, that's something that would be eligible, or prescription drugs, colostomy pads, hearing aids, things like that. The one thing I'm asked often is about parking costs. So you can only put parking costs on your tax return as a medical expense if you are traveling more than 80 kilometers one way to your medical appointment. So just something to think about. If you're traveling more than 40 kilometers, you can put on a per kilometer rate on your tax return. So that's something to look into. So again, you would go to the Canada Revenue Agency medical expense page, put in travel, and it'll give you all the travel rules and may give you other ideas for what you can claim as a medical expense on your tax return. So again, very, very general discussion. I'm not a tax professional, but I really think it's important for people to be, alert and aware of these things, because again, they are ways to potentially decrease your tax bill. And so somebody said that they saved their receipts and was told they were not eligible. But it depends what type of receipts. So again, the accountant will know when you hand over your receipts which are eligible and which aren't eligible. Moving away sort of from the medical and now other types of ways to help with your household and related expenses. So if you're in a position where you're having trouble paying rent, Toronto does have a what they call a rent bag, and it's interest-free loans that are available. If you're on Ontario Works or Ontario Disability, they do have what they call the Housing Stabilization Fund, and that helps with cost for rental arrears. If you have fallen behind in your gas or your electricity bill, you should look into our low income energy assistance program, which provides one-time grants to help you with those bills. Again, your income has to be below a certain threshold. And there's also the COVID energy assistance program. Again, a lot of the electricity and gas providers were providing help with overdue bills during COVID. Again, if your income is below a certain level, there's a way to reduce your bill monthly, and that's through our Ontario Electricity Support Program, and also for utility arrears. So again, gas and hydro, the Housing Stabilization Fund through Ontario Works and ODSP. If you are a low-income senior or low-income individual with a disability, you should look into, in the city in which you live, for any property tax and water relief programs. So there are no programs that are going to sort of make the bills disappear, but there are ways to, for example, defer increases in your property taxes. And so that's something definitely worth looking into. Help with transportation costs, which is, I guess, an everyday expense, but also a medical expense, really. Canadian Cancer Society has their Wheels of Hope program. So during COVID, on and off, they were offering free Uber rides to treatment. I think they ended the program at the end of May, but they do still have what they call their travel treatment fund that is helping. There are, again, in different cities, there are different services, but there are a number of sort of medical transportation services that provides lower cost transportation at a per kilometer rate. So in Toronto, there's Toronto Ride, there's iRide, there's the Red Cross. Yeah, thank you. Somebody just mentioned if you're in the Windsor area, it's called CareLink. And yes, always speak to the social worker at your hospital. In different jurisdictions, they may have funding available for transportation and other expenses. Wheel-trans is an option if you use the Toronto Transit Commission, and accessible parking permits are actually a very good thing. They're amazing for what they are. They allow you to park closer. But in certain areas of Toronto, you don't have to put money in the meter, things like that. So there are also some cost savings associated with an accessible parking permit. So something good to look into. And then, I put subsidized and co-op housing on the list. I think everybody knows the wait list right now for subsidized housing in Toronto is years and years. But it doesn't hurt to get yourself on the list. And again, always look into community agencies and charitable organizations. They may have, food service programs, donations of equipment, something like Shine Through the Rain Foundation that helps with, give a certain grocery gift cards and help with transportation costs, things like that. So always good, take a look and see if there are any agencies in your neighborhood that might help. Food banks are another good source. Check out what's in your neighborhood. If to lower food costs, and also if you're having difficulty making food, there are delivery services, and the sort of lower cost ones would be Meals on Wheels, and another one that delivers frozen meals is called Heart to Home. Okay, and good to know. I didn't realize Meals on Wheels in Windsor doesn't cater to vegetarians. Yeah, I haven't looked at the menus. I in Toronto, I'm not sure, but that would be an important thing to look for. And then helpful resources. Two 211 Ontario, or it's actually 211 Toronto if you live in Toronto, is actually a really good resource. If you're looking for anything, a service for one or another thing, just pick up the phone and dial 211, and they have access to a mammoth database of all types of resources. And similarly, you can access it online. If you're looking for government resources, you're going to want to dial 311. Another good thing that I sometimes refer people to is credit counseling. So credit counseling is, these are not-for-profit agencies that help you manage your debt. So they are not a trustee in bankruptcy. They want the opposite. They try and steer you away from having to claim bankruptcy, and they'll help you with debt management and maybe consolidating your credit, helping you with budgeting, those type of things. So it's a very good thing to have, and the bulk of their services are free because they're not for profit. And so if you Google in your area, you'll find a local credit counselor. Again, make sure it's a not for profit agency. The one I refer a lot of people to that I've heard positive things about is Credit Canada. And then lastly, if you're in a situation, maybe you need to appeal an Ontario Disability Support Program decision, so need some sort of legal services but can't afford them. There are community legal clinics that are income tested through legal aid. And if you go on the legal aid website, you just enter your postal code and your local community legal clinic will pop up. And they don't do all types of law, but they do help with certain types. And so that's something, if you needed legal advice, that would be a good source for you. Another good one is, I don't have it on the slide, Pro Bono Ontario. So Pro Bono, B-O-N-O, Ontario. They have a legal advice hotline that can help you if you have sort of a matter you want to discuss, with employment law or those type of things. So something else that's good to know about. And that is a lot of information that I've given. And so I give you here my email address and my phone number, because again, this is general information. It's a lot to digest. You are more than welcome to at any time contact me with questions, specific to your situation. And I would be, happy to book an appointment or just have a phone call with you, whatever would work.
Ilene, thank you so much for that presentation, and also thank you for you put your phone number and email there, and invited us to contact you, and for advice and information. I think potentially the source that you mentioned, 211, for Ontario, you mentioned that they have a wealth of information. I know that many of the cancer centers and hospitals have social workers.
Yes.
From your experience, is this a good resource for patients to seek, maybe even for things like filling out the forms, having one-on-one conversations about information along the lines of what you've discussed here, and how cancer might be able to seek assistance from various organizations. What's your experience with the social workers at the hospitals and cancer centers?
Phenomenal resource for everything that you mentioned, for finding out what programs might be applicable, for helping fill out paperwork, for helping get the doctor to fill out the medical paperwork. So the issue I've encountered lately, and where a lot of my referrals from is the social workers at the hospitals are very, very busy. They do that component, but they also do a lot of counseling and other types of resources. So you may be in a situation where it might just take some time to access a hospital social worker. Sometimes it's easier, sometimes it's harder. And that's where I get a lot of, my referrals from is, somebody at Princess Margaret will want a social work referral, but can't meet with somebody for a couple of weeks. But if you are able to connect with the hospital social worker, phenomenal resource. I work with them regularly. They're all unbelievable at the cancer centers. So I highly recommend it as a first stop. But again, if they're, busy and there's a wait, please don't hesitate, to reach out to me to help you come up with a plan, fill out paperwork, whatever I can do.
Okay. Tremendous. But another question, you mentioned there are some charitable organizations that might help in transport to the cancer center, such as the Shine Through the Rain Foundation.
Yeah, Shine Through the Rain. That one you have to apply through a social worker. So you can either do that through the hospital, or again, I'm happy to do it for you. Shine Through the Rain. I'm trying to think of other general cancer. And again, Wheels of Hope, their travel treatment fund.
Okay.
Which is, Canadian Cancer Society.
Right. And well, especially now with COVID, as you know, their ride services are not as comprehensive as they used to be, because of COVID.
Correct.
So,
exactly.
But knowing that they are still, available to provide, some type of support, via Uber or something else, and likewise with Shine Through the Rain. That's great. And of course, for some people, parking is a big issue. It's especially nowadays, people don't feel safe taking public transit.
Absolutely. Yeah. No, the only good thing about with COVID, I find people's parking costs sometimes are down because the family member can't go in with them to the medical appointment. So they just sort of hang out outside in the car, and they don't have to incur a parking cost. So that's been sort of the only thing. Somebody had asked about Shine Through the Rain, it is throughout Canada that you can apply.
Mm-hmm. Okay.
So sorry, somebody had asked, about their individual questions that I'm just going to see if you can. I'm just going to read it because the message just came to me. I'm just going to see if I can answer it generally. Okay, so the person that contacted me, I would suggest you reach out because I have some suggestions specific to your situation. I'll just quickly put up my contact information again, just so you have it. And if you give me a call or shoot me an email on Monday, I'd be happy to talk to you about it. Just because I don't think it's a quick answer, but happy to help.
And if it's okay, Ilene, we'd like to put your contact information in our next newsletter. But
absolutely.
Thank you so much for doing that.
My pleasure.
But my perception is that as I alluded to, the social workers at many of the cancer centers are sometimes an unutilized resource or underutilized resource.
Yeah. But they're amazing. So absolutely, get a referral and meet with them. And again, yes, the financial support, but also the emotional support, counseling support as well, for sure. Yeah.
Mm-hmm. Thank you. Yeah. This has been great. I've got 3.5 pages of notes here.
Okay. Yeah. Yeah, and it's a lot of information. It's hard to concentrate it in an hour and a half. So thank you for bearing with me as I got it all out and got you the information.
Mm-hmm. Well, and as we mentioned, we're recording this, and it will be available on the Myeloma Canada website, and we will also have an entry in the newsletter describing, some of the highlights of Ilene's presentation. So are there any more thoughts or questions? No doubt there'll be questions that will come up in people's minds afterwards. So, by all means, you've welcomed people to reach out to you. And the 211, that sounds like quite a good resource. What's your experience there? Like if I call 211, on Monday, would I be placed on hold for a long time
I gotta say with the Toronto number, I have to say I probably wait like a minute or two. And I called with a really specific, I had a client who was moving into subsidized housing and had no furniture.
Mm-hmm.
And my usual source for people like for free furniture has reallocated their resources during COVID. And I had a quick conversation with the person on the other end. They gave me 2 amazing resources that were able to get this gentleman some furniture. And it was just, it was quick and easy. So.
Okay, and there's a 2-on-1 everywhere in the province. Like if we were in
I believe it's everywhere. In smaller communities, it might be through a different thing. But if you Google 2-on-1 Ontario,
yes.
It should give you sort of the local area. Yeah.
Okay, and I believe that there are many people, most of us, who don't realize that these services are available.
Right, absolutely,
for anybody, but especially people of limited financial means. So knowing that these services are available is certainly, I think, great encouragement for those people who are really needful of these services.
Absolutely. There's stuff out there, and I got to tell you, Google, I'm not always a fan of, but it really does help you find local resources, things that you didn't know about. Always good to have somebody help you, but if you're looking for something, start searching for it. Try 2-on-1 Ontario, and hopefully something.
I want to go back to work, but I can't go back to work in the type of work I used to do. And I was wondering, there are 2 courses I'm considered taking. Is that possible? And how would that work? I mean, are you, I've never gone from, coming off a disability to trying to take courses to go back to work. I mean, are we?
So a lot, it depends. What are you on, a long-term disability or a government disability program?
The government ODSP.
Okay, so ODSP is usually, if you want to take a course here and there, they're usually, not particularly fussed about it. Are you looking just to take like a single online course, or?
Yeah, probably. Yeah.
Okay.
Yeah, it will be for a few months, and I'm hoping to be able to use that to get a position, and it will be online as well.
It'll be online, and is the course? Are you looking for funding for the course, or? Yes. Okay, that's a tough one. There's not a lot out there that funds specific courses. I always tell people to, wherever the course is through, to see if there's anything available through their financial aid office, to see. OSAP is mainly for programs, not individual courses. But if you want to reach out to me, I'm happy to see if there's anything that I can find.
Okay. Because the one thing I'm wondering is, like, considering COVID, even though I've had the two vaccines, I was still supposed to social distance.
Yeah.
So it's not that I don't want to go back to work. It's just there's just parameters that I can't deal with.
Absolutely. And not all places give you the option of working from home. So that's, right. I think it's a huge part of a returning to work decision. Absolutely. Yeah. But the good thing with the disability programs is, there's no pressure on you. You can return when you feel ready and when you feel safe. Thank you very much for having me.